Soul Healing Foundation is a non-profit organization led by clinical psychologist Mam Sajda Kazmi. Soul Healing Foundation works for the betterment of psychologists and mental health awareness. Your mental health is a priority. Join Soul Healing Foundation as we celebrate Mental Health Month, which would include graphic messages, content, video messages, short films, meaningful podcasts, insightful panel discussions, and enlightening video lectures. Assalamu alaikum everyone. I am Zarmeena Al-Kareem, a student of MS Clinical Psychology from Rifa International University. I am currently an intern in Fauji Foundation Hospital, Rawalpindi, under the supervision of clinical psychologist Mam Sajda Kazmi. I am also a member of Soul Healing Foundation, which is a nonprofit organization working for the betterment of psychologists and spreading awareness about mental health. I welcome you all to today's podcast. Before starting, I would like to introduce our guest speaker. Today, we have with us Ms. Laiba Waheed, who is a psychology student in Fatma Jinnah University, and she is also currently a member of Soul Healing Foundation. Thank you so much for joining us today, Ms. Laiba.
It's a pleasure from my side. Thank you so much for having me.
You're welcome. Okay, so the topic for today's podcast is mental health advocacy. Since we're celebrating Mental Health Month, we will be covering topics related to mental health. Now, Ms. Laiba, I'll start with my first question. We know how important mental health is. We know how much we emphasize on it. We know how, when we talk about advocacy, we know it plays a crucial role in raising awareness and reducing the stigmas and overall improving and promoting the well-being of individuals. And with the passage of time, we also know that mental health challenges are on the rise. So it is very important that we talk about such topics. So
yes,
when we begin with the introduction, how would you define mental health advocacy, and why do we say that it's important?
okay. So first of all, let's talk about its definition, but let's keep it simple, just so everybody can understand it. So mental health advocacy, it's more of an umbrella term. It's a multifaceted concept where the individuals, they take some actions and they do some sort of effort to raise awareness and promote and empower individuals who are facing mental health crisis. And even if they are not facing any sort of crisis, what happens is that we also look into the individuals who are at the risk. So it's not that we are just focusing on the people who are facing mental health illnesses. We are also focusing on the people who we think are at the risk, or they might be in progress to develop any sort of mental health illness. So as I mentioned earlier, it's a sort of a multifaceted concept. So there are so many there are so many terms that fall under its arena. What actually happens is that these they I'd like to mention that it's not able to be a mental health activist or a mental health advocate. If you should not be considering yourself that, oh, I'm not a mental health practitioner. How am I supposed to advocate people about mental health or the illnesses? So it's like anybody who has a sound knowledge, anybody who's aware about the illnesses or about any symptom or anything, they uh, obviously the person who has the sound knowledge, they may also be curious about the mental health illnesses and how these situations are developed. So everybody can have a knowledge, everybody can have awareness about it. They can get themselves into these workshops, these seminars, and they can be they can be the beacon of hope, and everybody can do that. So when we talk about the importance, first of all, as we are Pakistani citizens, and we have seen these things since our childhood, that the stigmas are very prominent. There are so many stereotypes, those are basically highlighted when it comes to mental health. So I guess through mental health advocacy, that get, and this is something they highlight, that these are the stigmas and we can work together to reduce the stigmas. And second, and most important, which we always talk about, it's raising awareness, because obviously within this advent of social media, many people know about mental health, but still there are so many indigenous areas, there are so many people who are vulnerable, and they still lag behind, because they don't have knowledge about it, and they are not aware about the situations. So the next one is, why is it important, is because we are here to help people, and we are here to guide them about the resources those are available in Pakistan, and improve this access to care. Once we tell people about the resources those are available, about the policies those are made, about the initiatives those are being taken, because you see all around the world, especially when we talk about our area, many initiatives have been taken, even if even in the mental health month and mental health day, so many initiatives, so many workshops going on all over around us. So there is so much on the internet, but through advocacy, what we can do is that we can improve access, and we can get people to know about the resources, and we could actually help out and support the vulnerable population. And I guess the next one is obviously about empowering individuals, because what are we here for? So I guess there are all these things, they basically lead to for lead towards a better society. Advocated people, individuals who know that, okay, I'm facing this problem, I know where should I go, where should I contact, what people should I be contacting, what resources are there to help me out, even if these the treatment is unaffordable for so many people. There can be several reasons. If the person, they are not they cannot afford it. So what are the areas, what are the locations, those are going to help me, because there are so many non-profit organizations, just like the ones we are working with.
Exactly.
So there is help, but we, through mental health advocacy, what we can do is that we can be that mediator who takes the people towards that particular place, and we could actually help them out. So it's like we can prevent suffering, and we can prevent the crisis.
We're working to address these issues and to overall promote mental health, and we're highlighting it as an important aspect of our overall well-being. But when we talk about the work that an advocate has to do in order to spread awareness, it's easier said than done. What would you say that what are some of the common challenges that are faced by the mental health advocates, and how do they, once recognized, how do they overcome them?
Okay, so parts of first the challenges. When we talk about Pakistani community, first challenge that advocates may be encountering is about the stigmas and the discrimination. We see so many people letting the other person down. If a person is obviously they have this insight, and they actually recognize that problem that they are facing, and they may be recognizing that, okay, we are at risk, and we may be developing such a problem that may be problematic. And in our society, we basically focus on physical fitness, and mental fitness and mental health is overlooked, because it has been stigmatized, it has been stereotyped. So the first challenge that an advocate, according to me, has to face in a Pakistani society is, the first one is about the stigma, and it's about the discrimination that is carried out. And when we talk about Pakistan, obviously, when it comes to mental health, um, limited resources. We don't have the exact resources we don't have the adequate access to care. And even if we have, there are so many people who don't even know about these things. There are so many people at risk, and there are so many people who need our help. But these all things, they are not properly channelized. And even if they are, this information is not reaching the indigenous area. Information is not reaching to the layman. So we have this limited access to resources. And the most important factor that I like to highlight over here is the resistance to change. Obviously, we can relate it to the stigma. We can relate it to the discrimination that is being carried. Is basically is it's stopping us from going towards a sustainable future. So the societies, they have this particular attitude, they have this beliefs um, about their own concepts that they have been given from childhood. So most of the people, although there is such a revolution that has been made, people are actually coming forward, people are actually talking about their mental health, but still so much work needs to be done. So the individuals and the institutions and the communities, they need to come forward, they need to talk about this resistance to change, because if we are to bring any sort of revolution, if we are to bring a change, everybody needs to work for it. And we shouldn't be talking about this fact that how can I make a difference? What are my actions going to do?
Exactly.
Even if you talk about it, even if you take a little action, to understand that obviously small differences will lead to a greater revolution. So we shouldn't, just disregard our actions. We shouldn't just disregard the fact that obviously we can make a change. And in order to overcome it, what we need to do is that we need to broaden our perspective. We need to stand together, and we need to stand as one. And this can be done through certain partnerships, like organizations, or even the hospitals, the medical practitioners. I know everybody is so talented in Pakistan. There's this ton of talent and skills. People don't lag because they don't have skills. People lag because they don't know how to channel it, they don't know how to network it. So if people come together, and they're making this whole community, and they're working for the welfare, obviously we are going to make a great difference, and our actions are obviously going to make a louder voice. So and I think that social media, it also plays a huge role. And this thing cannot be overlooked. When we talk about social media, we talk about telehealth, we talk about technology, this thing cannot be overlooked. If we are advocating people, then social media is something that we have leverage on. We are privileged because if we have this message, we are sending this message, and we are doing it through social media. Obviously we are sitting at our homes, and we cannot reach everybody, but through social media, through technology, our message is going to be seen by so many, it's larger population. And even if if you're giving your message to 50 people, if one person among those 50 people is implementing that thing, I think that is a lot about your effort. It says a lot about what you are doing for the society. So I think these are the factors, these are the challenges, and this is how we come.
Exactly. I think that was a wonderful response to this question, because it is a very common question among people. So I'll start moving on towards the end of our discussion. People choose to become mental health advocates for, we can say, a variety of reasons, driven by personal experiences. Either it's empathy, or it's, the desire to make a positive impact. Everyone has their own motivations. But my question from you is, how can individuals get involved in mental health advocacy, even if they're not mental health professionals?
Yes, this is a very common perspective. It's a very common misconception among the people, that how are we supposed to, or how are we going to advocate people if we don't have knowledge about it? if we haven't specialized and we don't have a degree. So I think everybody can be a mental health advocate, but for that, we'll have to go through certain phases. We'll have to educate ourselves. And, I think everybody is well aware of the usage of social media, and everybody knows what is a scam and what is this proper source of education. And if if a person is curious, and if a person has this this um I don't know what's the particular term, but if this person has this this passion to learn and to help individuals, then the person would obviously, they'll know what are the particular resources. They'll go, they'll go and they reach out for it, and they'll obviously educate themselves. So the first thing that comes when you are on your way and you actually want to advocate people is by advocating yourself first. So we need to educate ourselves. And education is something, you're reading a book or you're reading an article. Obviously it has so many phases. You can learn about the policies, you can learn about the resources, you can learn about the organizations, about the NGOs, about the how can you access these things. And then you may get yourself involved in these channels, in these networks. You may expand your networking. You may support a mental health organization just the way we are. So it's the way that, first of all, the first step that you need to do in order to nurture yourself, in order to get yourself into that stage where you can be an actual advocate and you could be that beacon of hope. I think the first thing that we can count on is about educating yourself. And the second one is, you should support and you should get yourself associated with a mental health organization. Because once you see the other people who are working, because I think that if you talk about the mental health organizations in Pakistan, if you talk about the NGOs, organizations, I think that they have got tons of passionate people who are working solely for the welfare of the society and the welfare of individuals. So I think that once you go and you experience all the things, you experience the way they are working, you see their system, and you give a deep look into that. So I think you'll get the individuals who are on their way to become an advocate, they can get an insight about how these things work and how they can they can help the society. So it's all about sharing the resources. It's all about expanding your networking. It's about using the social media and working against the discrimination and working against to fight stigma. So I guess that's all. That's the way you can become mental health advocate, and you can actually bring yourself and polish yourself to get at that stage.
Thank you so much, ma'am. Laiba, I think that was a clear-cut answer to our question for the individuals who do want to join the path of mental health advocacy. And I think I would say that, our organization, Soul Healing Foundation, it is doing a rather true, I'd say it's a splendid job at raising awareness and, on you mentioned social media platforms. So I think it's doing a great job. All praise to Ma'am Sajda Kazmi and the associated members of the organization. Also, I really would like to point out where you keep on admiring the talent and the passionate people that we have in all fields, And, we need all of those people to come under one umbrella and to work for this cause, because ultimately and eventually the motivations for becoming a mental health advocate are diverse. We do know that. But at the end of the day, they all revolve around the desire to create a more compassionate, inclusive, and a supportive environment for, the individuals who are dealing with mental health challenges, because we all are. So I think that would be the end of our discussion. I would like to express my sincere gratitude to you, Miss Laiba, for giving us the time and, coming here and talking about and answering the questions. Thank you so much.
क्या हो गया है?
Laiba, I can't hear you. Mute हुआ है आपका mic.
मुझे आपकी आवाज आना बंद हो गई थी.
Okay.
I wasn't able to hear you.
I thanked you, so you just have to say welcome and thank you so much for having me.
Okay. Okay. I have to say welcome.
Yes.
It kind of broke my flow, you know.
Okay, it's okay. I'll edit it.
Okay. Welcome, Mr. Meena, and it was an honor. It has always been an honor to be a member of Soul Healing Foundation, and an honor to, do these podcast episodes where I could spread awareness as much as I can. Thank you.
You're welcome. Allah Hafiz.
Okay, we are not ending it here.
Thank you so much for watching our video. Stay tuned for more content. Don't forget to like, share, subscribe our social media platforms.